Okay, thanks for watching, everyone. I am just looking for a little bit of feedback on this presentation. It's the basic outline for what I'm going to be presenting at the end of June, and I'm looking for any ideas of what you guys think about it, anything I should change, if there's too much group activities or what your thoughts are. So here it goes. I'm going to give you the Reader's Digest version as we go along here. So I will be talking about fall prevention, and the main focus of this presentation and training is going to be on an interdisciplinary approach. So what does that interdisciplinary approach mean? So here I have two figures depicting a multidisciplinary approach and an interdisciplinary approach. So for the multidisciplinary approach, this is something commonly used in all different settings. You're looking at more than one discipline being involved in the care. You aren't just going to have a nurse looking at something if they have falls. You're usually going to have physical therapy in as well, sometimes occupational therapy. And then depending on a client's needs, you're going to have speech or social work as well. So this is just saying all the disciplines are involved. They're all doing their own thing to help the client. In the second picture here, that's the interdisciplinary approach. That's what I want to focus on, is more of that collaborative team approach. So not only are the separate disciplines involved, but they're working together to collaborate for the best outcomes for the client. So that means talking, setting goals together, discussing progress. It's really kind of a collaboration where you're discussing clients together. So I want to ask you guys, what do you do now to collaborate with your team? For instance, one good example is the interdisciplinary team meetings we have once a month. But what else are you doing to collaborate with your team? So think about that for a minute. Okay. Then I'll have everyone kind of talk amongst themselves, talk about what they do to collaborate with the team. We'll kind of discuss all those answers, and then I'll bring up what else can we do to collaborate? What can we be doing more? Could we be doing more emails? Could we be doing more phone calls, text messages? What do we think we could be doing ourselves to make sure we're incorporating that team approach with each of the clients we serve? So next I'll talk a little bit about the importance of collaboration. So why is it so important that we're talking and we have this team approach and we're working together? Why can't we just all do our own thing and hope that works out for the best? Well, I'm giving a few examples here of what I've come across just in my work on why that collaboration and team approach is so important. So first of all, it's really important for reconciling different stories and ideas. I think we all know we've been in this situation where we go in, we hear one version of a story from a client or their family, and then a different therapist goes in, even if it's the OT, and then the CODA goes in and hears something different, or the physical therapist goes in and hears something different. So one specific example I have recently was a case of a guy who has dementia living in a memory care unit. I went in and asked the staff, how are the Easy Stand transfers going? Because that seemed like something that would be really difficult with someone with significant dementia. And they told me it was terrible. It was unsafe. He wasn't able to hold on. His knees were buckling. So I wrote an email, brought that up with physical therapy, and they had heard a totally different story. So staff that they had seen there, and it could have been a different shift, different person. That staff member said, "Oh, the Easy Stand transfer is perfect. We have no worries." So a lot of times we're getting all these different stories, and it's important for us to discuss and come together as a team to find out what's really going on, and really get to the bottom of it to make sure we're best serving our clients. Another reason collaboration is really important is to make sure we're reinforcing one another's recommendations. So let's say I go in and see someone for occupational therapy. I'm going to tell them, I'm obviously not the best equipped to recommend an assistive device for you. So if physical therapy comes in and they recommend a walker, but then the client's telling me, "Oh, it's okay, I use a cane, I don't use anything around the house." If I don't know what physical therapy has recommended, I'm not reinforcing that for the client. And I think we can all tell just from past experiences, the more that we talk about something, recommend something with the client, and the more we're on the same page and bring it up, the more apt the client is to follow through on that. At least that's something I've noticed a lot from my personal experience in working with people. So another importance of collaboration is making sure our goals are different. And this typically happens more so with PT and OT. You know, a lot of times we're like, oh, I need to work on this transfer. OT will say, oh yeah, I need to work on this transfer. And then we're both working on a toilet transfer. So the more we're talking about what the client's needs are and who's going to address what, the better our documentation is going to be, and the better it's going to look. The last importance of collaboration here would be notifying of a change in status. This is huge. If a client takes a fall, we want to make sure we're all involved, either through an email, a text message, on what happened, when did they fall, what were the circumstances surrounding it, so you're not walking in blind, you know, the next time and saying, oh, I had a fall, didn't the physical therapist tell you, or something like that. Notifying of that change in status is really important. Also, I think from what I've found, email seems to be a great way for collaboration. But again, I think it's important that everyone kind of works through and figures out what the best mode is for them. But I've noticed that way you can put more of the team members on. They can get back to you at their own pace. You know, sometimes it's difficult with text messages, especially on weekends when people aren't working and things like that. It's just really good to kind of have an email approach where you're able to type up all your thoughts, and then it can kind of go through the chain of people that way. Okay, so I'm going to go over a few of the fall risk factors, or the main 4 in this slide, that have been found through the research. So we're going to talk a little bit about balance and gait, a little bit about medication, a little bit about environment, and a little bit about vision here. And again, these are just the 4 main one. There are many, many more risk factors. But it's interesting, you can tell from each one of the 4 listed here, a different discipline kind of looks at each one of these. So you can tell how that multidisciplinary and even interdisciplinary approach is really important to fall risk. Okay, so the first is balance and gait. So this typically encompasses everything from coordination, flexibility, to specifically balance and specifically gait. Vision is another important factor that I don't think people consider as much, and I've noticed this in my own practice. You don't really think about exactly how the person is seeing and how that can affect falls. So one of the most common things is low light in the house, so they're already having trouble seeing, and then they don't have the lights on, so they're more susceptible to tripping over something, not seeing something, things like that. Bifocals were actually listed as one of the biggest things under this as well. So that is most specifically for people who are wearing bifocals and going downstairs, because that vision change from the top of the bifocal to the bottom can make a big difference. Clutter was something that's really important with vision too. If you're having trouble seeing and there's a lot of things in your path that you can't always see that are easy trip hazards, that's something to consider for people. And then prescription glasses. This is one of the biggest things, is just encouraging clients to make sure their prescription glasses are the right prescription and they're getting tested when they're supposed to be every year, whenever that is. Medication. So this is a very big nursing topic that I also don't think people recognize as a huge fall risk factor. Dizziness can be caused by some of these medications, dehydration, and then those medication interactions, which I know we're always doing at Start a Care to determine if there's any interactions that could be causing fall risk, or any of these symptoms to occur that could potentially cause falls. Okay, environment is the last biggest one. This is pretty much everyone's involved in this, but a lot of times it's occupational therapy as well. Clutter, which was listed before in the vision section. Stairs, you know, how are people doing with those? Do they have enough equipment? Do they have handrails? How are they navigating them? And then the bathroom, especially the shower, is a huge fall risk area. And then in the kitchen, some kitchen tasks and things like that. But of course, there's so many different aspects to an environment that could play a role in fall risk. Okay, so what other fall risk factors have you guys encountered? So I'll kind of ask everyone to talk in a little group about what they've experienced for fall risk factors, what they think the major ones are, and then we'll bring it back as a whole and kind of talk about the other major ones people have noticed. Here is just a list of some of the other fall risk factors that came up in the research I did. Neuropathy is a big one, not being able to have that sensation in your feet when people are walking. Proper footwear, this is a big one too. Are they just wearing socks and sliding? Are they wearing their shoes everywhere to make sure this doesn't happen. Blood pressure is a big fall risk factor. A history of falls. So anyone who's fallen in the past year has an increased likelihood of falling again. Risky behaviors. So this are people who are climbing ladders or using step stools to reach for something they can't reach, or, things like that are on the risky side. Acute illness, obviously, because along with that often comes that muscle weakness and reduced strength. Alcohol is a big risk factor. Muscle weakness, confusion, cognition. So a lot of our people who are in memory care units or things like that don't recognize that they're not able to walk and move around the way they were, so they're trying to get out of bed and falling or things like that. That can be very tricky. Age is a fall risk factor. Just being over age 65 greatly increases your risk of falls. Inappropriate mobility aids or none at all. So using a cane when you should be using a walker or walking around without anything. And then another fall risk factor is just living alone, typically just because people are doing more on their own. There's no one to ask for help or to monitor how they're doing or things like that. Okay, so lastly, I'll kind of end here with a case study. So this is going to be a very, very broad case study, which, often happens in our in our line of work. You have Ed who lives in a senior apartment. You come in to see Ed for a scheduled visit and find out he had fallen over the weekend. So, what kind of questions do you ask him about the fall? And then how do you notify and discuss the fall with the other disciplines involved? So this is something I'll have everyone kind of talk amongst themselves in their own table, think of some ideas, and then come back together and we can kind of discuss it as a whole. Okay, so lastly, the takeaway message from this presentation, if you guys just take away one thing from everything we talked about tonight, it's collaboration. Collaborate, collaborate, collaborate. That is the main goal of what I've been talking about. It's great that all of us as individual disciplines go out, do our assessments, come up with goals and interventions, and we're working with a client. But the way they're really going to have the best outcomes and be able to take their care to the next level is really going to be to make sure we're working as a team for their best interests. So whatever we can do together is really going to benefit the client. Research has shown this time in and time out that this is the best way for us to take it to the next level. So my challenge for everyone is to, throughout this week, look at one client that you maybe done evaluation on or you maybe have some concerns with, pick that one person, kind of just send a quick email to the whole team about what you've seen, what you think, what you've heard from family and the clients, to make sure everyone else has heard the same thing, is on the same page. And then hopefully the other disciplines will just chime in with a little bit too. I mean, it's not something where we need to be doing this on every client. I know that's not reasonable. And I know we're already doing it on some. So it's really just to take it to that next level. And with a few of the people that are kind of in between, to really just go the next step and write that little email, develop that extra little bit of collaboration with your team. All right, thanks.